Hi, this is 3MD coming to you with the last month in review, March 2020. For decades, experts had been warning us that we were not ready to face a worldwide pandemic. In the beginning of March, we were still not sure if COVID 19 would be the big one. But already, what humanity needed to do was clear: reduce crowds, enable more people to work from home, cancel sporting events, school assemblies, and parties, and even unnecessary visits to the doctor's office, all so that we could slow down the spread of disease. In early March, there were around 100,000 confirmed cases with 3,000 dead around the world, and 300 million children were at home away from school. Airlines were cutting flights amid fears over contagion as travel bans were imposed. Even the world's holiest sites were completely emptied. Factories were closing down in China, gondolas were floating empty in Venice, as the international tourism sector took the worst hit since 9/11. As people were starting to wear masks in public and panic buying peanut butter and toilet paper, more than 10% of the world's population was in mandatory lockdown. Church services, parades, and festivals were being cancelled, and quarantines were being imposed. The world stood still. Contrary to what had happened 12 years ago, there was no international effort this time around, as each country had to fend off for itself with medieval approaches to disease, such as isolation and quarantine. Decades of underfunding had left the World Health Organization irrelevant and undermined by its own members. The 5th of March, the markets took a 1,000-point hit, following another 1,000-point fall only 3 days before. Panicky discussions erupted over a potential repeat of the Great Depression. The bloodbath on Wall Street was followed by an oil price war between Saudi Arabia and Russia. The coronavirus was being used as a scapegoat for many irregularities of the neoliberal world economy. Would the coronavirus pandemic trigger the death of neoliberalism? COVID 19 was accelerating the process of disintegration, which could end up ushering in the long awaited post Cold War world. The crisis revealed the cracks in globalization and the dangers of offshoring all production. The era when governmental institutions were eclipsed by multinational corporations acting to maximize profit seemed to be approaching its end. In the face of the pandemic, governments no longer seemed like the enemy, but the solution to a very general public health crisis that could not be countered by multinational corporations. The real culprit behind the economic downfall was not the invisible enemy, but the gilded barons of neoliberalism. Our neo-feudal system was on the verge of collapse. The West needed to restore the link between the financial system and democracy. Some claimed that the coronavirus could actually fix globalization. Maybe the pandemic was only stress testing the global system. Perhaps what was needed was a fractured globalization, stepping back to more compact partnerships, reducing the length and vulnerability of supply chains, and creating alternate sources of supply for everything from energy to electronics that no longer require dependence on the revisionist powers. Supranational entities such as the EU proved to be irrelevant, as even the founding members were left to fend off for themselves, such as Italy, where the entire country was in full quarantined lockdown because the Maastricht Treaty designated healthcare as a national competency. As the European Central Bank warned that the coronavirus could trigger an economic crash similar to 2008, Angela Merkel was warning that 2/3 of Germans could become infected. Past mid-March, the EU borders were suddenly back together with a 30-day ban on entry by outsiders. There were unprecedented draconian measures in peacetime. At the time, UK Prime Minister Boris Johnson was declaring that Britain would face off the invisible enemy on the beaches and that there would be no surrender. Johnson's Churchillian rhetoric would not keep him from getting infected by the virus. More concerned with the economy, Johnson rolled out a rescue package almost worth $40 billion. Whilst the World Health Organization finally announced that the crisis could officially be called a pandemic on the 11th of March. And the unthinkable happened. For the first time ever, the US imposed a 30-day ban on travel from the old continent. The United States were amazingly unprepared for the spread of the novel coronavirus, despite the fact that they had to fend off against the swine flu pandemic in 2009, as well as the Ebola and Zika virus outbreaks during the former decade. The United States had evolved from being a nation of industrialists to a nation of financial rentiers. This exposed significant risk during the crisis. The pandemic simultaneously marked the decline of US leadership and exposed America's authoritarian turn under the Trump administration. The US was losing its world superpower status due to its failure to lead the crisis response, and that this time it might not be able to recover. The coronavirus crisis was the equivalent of Suez and Afghanistan for Trump's America. However, some still saw the US emerging stronger in the pandemic's aftermath. Perhaps this would rather be a Chernobyl moment. However, both the US and China were trying to leverage the crisis to their own advantage. The two countries had turned the coronavirus into a sort of geopolitical football, the former playing the blame China game, while the latter using the outbreak to boost its global reputation. For instance, China sent 300,000 face masks to Belgium in a container carrying the slogan "Unity makes strength." Meanwhile, the US had made no similar gestures. Instead, started calling the novel coronavirus the Wuhan or the Chinese virus. China could potentially threaten to wreak havoc on America's drug supply because China manufactured most of the generic drugs taken by the Americans. Just as China had to deal with this problem of unregulated markets for wild animals, the US had to deal with this hugely expensive private healthcare system, which did not have the public health capacity to deal with the spread. In late January, China had put in place unprecedented containment and social distancing measures, locked down major cities like Wuhan, and imposed travel restrictions throughout the country. As testing was rapidly expanded, patients with mild symptoms were placed in temporary isolation facilities, converted from various public buildings, and new hospitals were speedily constructed. Almost 60 million people were placed under a lockdown in Hubei province alone. China's use of high tech in fight against coronavirus was making headlines. 5G robots? You got it. 3D printed supplies? Yes. Robots delivering packages, AI-backed voice assistants, as well as unmanned drones were not sci-fi anymore, and China made use of all of them. Some of the methods could not be replicated in most democratic countries, such as the collection of mobile phone location data and facial recognition tech to track people's movements. When China paused its economy, the world began to realize just how dependent they were upon their economic links with China. One thing that China did right, though, in the face of the crisis was its supply-side structural reform. An increasing number of people with minor ailments have learned to make appointments online, receiving diagnosis and advice from doctors without ever stepping a foot in a hospital. Well, China's advantages included taking decisions efficiently, mobilizing forces effectively, and pooling resources to accomplish large undertakings. China rightfully decided on banning the trade and eating of wild animals, such as bats and the pangolin, while also speeding up its biosecurity legislation. The fact that even paracetamol supplies depended on China was underlining the West's pharmaceutical dependence on Asia. The same appeared to be true for mask supplies and sanitizer gels. Europe imported up to 80% of its active pharmaceutical ingredients. Chinese manufacturers making around 40% of all active pharmaceutical ingredients used worldwide. China was sending medical equipment to Italy, as well as to other countries such as Cambodia, France, Iran, Philippines, and Spain. The crisis modified China's perception in many places and may have a profound impact on future foreign policies, as President Xi Jinping was talking about a health Silk Road. But the draconian measures implemented in China did not seem to be the only way to contain the outbreak. Some were looking at how Singapore, Taiwan, and Hong Kong were containing the virus. They had implemented similar measures, namely travel restrictions, quarantines, as well as self-isolation, social distancing, and heightened hygiene. They all had to contend with the SARS outbreak of 2002 and 2003, and they had internalized the lessons of that experience. Each in its own way had been able to interrupt the chain of the disease's transmission without embracing the highly disruptive, drastic measures adopted by China. In Singapore, the details of where patients live, work, and play were released quickly online, allowing others to protect themselves. Disease control infringes on individual liberties, and places like Singapore, where chewing gum was once banned, are more willing to accept government orders than others. For all the panic erupting elsewhere, most Singaporeans do not wear masks out because the government has told them that it's not needed for their safety. Most schools are still running, albeit with staggered lunchtimes to avoid big crowds. There's plenty of toilet paper. Testing is free, as are medical treatments for all residents. A more democratic success story from Asia was South Korea, testing then up to 20,000 people per day through drive-thrus, test centers, and self-monitoring apps, also using big data and GPS to track the movements of the infected. Another important point was that, like most other East Asians, South Koreans were already used to wearing masks to fend off pollution. The world as we knew it had stopped spinning around. Whole countries were in lockdown. Many were confined to their apartments. An economic mega crisis lied ahead. In fact, we were caught in a triple crisis: medical, economic, and mental. There was de facto martial law, as a new normal was being prepared, accompanied by rumors of social media tracking and censorship, restrictions in global travel, more robust border controls, and eventually mandatory vaccination. 5G became inevitable as social isolation normalized remote learning and working, just as we realized that society needed just a few essential professions in order to continue functioning. Would the new age bring increased nationalizations in economic models, as we witnessed at the beginning of the universal basic income, the disappearance of cash, and questions over mandatory medical training? Good could come out of the quarantine and isolation measures too, especially for the introverts. The crisis presented a rare opportunity to concentrate. Just as the great English poet John Keats had used his 10 days of quarantine due to the typhoid epidemic in Naples to write the memoir of his childhood. Or as Isaac Newton, who formed many of his famous ideas during the plague of 17th century London, all of us collectively and individually had to do what was expected of us. After all, wasn't Camus' protagonist in the play, Dr. Rieux, correct when he was saying that the only way to fight the plague was with decency? Decency in the face of pestilence redeemed humanity. Perhaps this was a sign for humanity to do things more equitably and ecologically. At the end of March, we were living in what seemed like a dream, a surreal world of inactivity and uncertainty. A silent spring had erupted on the northern hemisphere, a spring of fears. Well, that's last month in review, and if you liked the video, be sure to leave a thumbs up, hit that subscribe button if you haven't already, and state your historical emergency in the comments below. And as always, thanks for watching!